So I have medication orders from the provider for my patient. I have done the 6 rates. I've got the right patient. I'm going to assess my patient's abdominal area before listening for anything we don't want abnormal, any discomfort or distension there might be that needs to be noted. And then I'm going to perform hand hygiene. And my tubing is clamped, ready to go. And I'm going to test the gastric pH levels to make sure that we are still in the right place. We want to be in the stomach. So about 5 to 10. Clamp that back up. And that should read on the pH strip should be 1 to 4, no greater than 6 again. And if we were doing a small bore feeding, we'd have to do a abdominal X-ray to make sure that we were in the right area. All right, and then we want to elevate the patient to at least 30 degrees and want to keep them that way 30 to 60 minutes after the med administration to make sure it's being absorbed completely. Got my sterile water, my 2 medications. I'm going to pull those up right now. Ensure there aren't any bubbles. You don't want any bubbles going into our line. And again, check it for bubbles. Look good. All right. Okay. So I'm going to undo or unclamp. Attach this here. And I want to start by administering 30 to 60 mils of sterile water. And this will just clear everything and get the patency good for the medications. Alright, and then I'm going to clamp off before it gets to completely too low. We don't want to get any air in there. And I'm going to administer the first medication. And let that go. And then I would get 10 milliliters of the sterile water. And that's for in between medications. I only have 2 medications, so I just need 1 10 ml in between. Alright, we're getting pretty low again, so we're going to clamp there. So we still have some in there. Get my second medication. Administer that. I would throw those in the sharps container. And then for the end of my med administration, I would want at least 30 to 60 milliliters of stale water to really just get all that medication in there and make sure it's all being absorbed. And then just as we wait for this medication to fully go in, some side things I think I already mentioned, leaving the head of the bed to 30 degrees 30 to 60 minutes after the medication is administered. I want to reassess my patient, listen to their stomach, anything funny going on in there. They start to have some adverse side effects. We don't want that. Making documentation in the MARS and assessing vitals. Alright, and once that's all done, I can remove that and reclamp. I would not want to put on any suctioning right now. We want to keep that medication in there to be fully reabsorbed. But yeah, just making sure my patient is doing all right and everything's going well. And then I would perform hand hygiene and doff my gloves.